So you had to stop the biologics. They weren't working anymore anyway. The latest one you were on had already started to not be effective.
Right.
You'd already had a few
I'd had to do a couple of prednisone bursts that summer. Summer of 2018. The last one I did was in August. I had to do another prednisone burst because Actemra was beginning to fail.
Right.
And then we had a major life change. We had a grandson move in, and then we had another grandchild that we needed to take care of. He was placed with our daughter as his guardian, and we had to take care of both of them full time, which put all of their germs around full time, and I was immune suppressed.
Right.
So some people can handle that. I was getting sick. Mm-hmm. If I was exposed to anything, I was catching it. And 2 months into taking care of those kids, I got an upper respiratory thing, and I was sick. I didn't feel horribly sick or anything. I thought I was beating it, but I remember I had gone over to your house. You and Vicky and I had gone, another sister of ours, we had gone shopping. She was in town, and we had gone shopping, and we went, she had some errands she wanted to do. Mm-hmm. And then I went over to your house, and we all had dinner there. Mm-hmm. But then I remember going from just feeling kind of like I had a cold to when I left your house, I felt like I couldn't even walk to the car. I just didn't know how I was going to even get to my car.
Right.
And I think I was already getting kind of confused. I was feeling confused and kind of a little bit not rational. Mm-hmm. Because I found out later I was spiking a fever and quickly. And so I drove home and literally dragged myself into the house, and then I just lay down on our sofa and I didn't move. I covered up under every blanket that was anywhere near me that I could reach without getting up. And I had blankets all over the back.
Because of the fever.
So, yeah, I was so cold.
Yeah.
And then the last thing I really remember was shaking violently. Mm-hmm. And I've had a lot of fevers in my life where I had the chills. Mm-hmm. This was not that. Mm. This was what they call the rigors. My body was violently shaking, out of control shaking. And I couldn't stop it. Yeah. And I think that was when my husband called you guys. Because he said that I was refusing to go to the hospital.
Right.
So, does that sound like me? A little bit.
Yeah.
I'm like, no.
Right.
So, I mean, really, when you have an autoimmune disease, what are they going to do for you in the emergency room? They can't help you in the emergency room. So
but this wasn't that.
No. Emergency rooms are for broken arms and car accidents and heart attacks.
And it turns out pneumonia.
Yeah. Because really, you need a doctor that knows you and knows what's going on.
Right.
The emergency room doctors, they're trauma doctors. They're not meant for day-to-day health.
Right.
So anyway, he talks me somehow. He piled me into the car. He said he put me in the back, like he opened up the SUV and put me in the back, and just drove me to the emergency room. Anyway, all of the labs in the emergency room were showing I had pneumonia for sure. They did x-rays and I had pneumonia, and they were showing that I was becoming septic. And so all of the labs in the emergency room meant a free ticket to a bed upstairs. Mm-hmm. So as soon as they had a bed available, I was hospitalized. I have never been hospitalized except to have children. Mm-hmm. And back in the day, when you had your tonsils out, you had to go in overnight.
Right.
When I was 2, I was in the hospital overnight for one night for my tonsils. That was the last time I'd ever been hospitalized other than to have children. Mm-hmm. And my deliveries with my children were uneventful. The babies were the only event. So I didn't have to stay extra days or anything like that. Mm-hmm. I was fine. I had a baby and I was fine. I went home. Baby was fine. Everybody was fine, which I know is a blessing.
Right.
So being hospitalized was really weird. That was a weird experience. And I remember telling my husband, this is because I was immune suppressed. Mm-hmm. This happened and I got this sick this quickly because I was immune suppressed. And I said, this just doesn't make sense anymore. I said the eulogy's going to say, well, at least she wasn't blind. Right. She died, but, we preserved her vision.
Right.
So there's just such a balance. There's a balancing act. It's just a constant roller coaster of balancing the risks.
Yeah, and
against the benefits,
and knowing that was probably going to be what would happen at this point, and the fact that that medication had stopped working anyway.
Right. So the doctor I was kind of nervous about seeing my uveitis specialist again and seeing my rheumatologist again. And I actually had appointments with them that I missed because I was in the hospital. And I had just gotten out of the hospital and I was too sick to go to doctor's appointments. So I missed appointments with both of them, and I was nervous because I was going to be telling both of them, I'm not doing those treatments anymore. I'm not doing biologics. I'm not doing immune suppressants. You got to come up with what's next. And some doctors say, well, that's what I'm doing. If you don't want to do that, then maybe we need to part ways. And that could have happened.
Right.
So they might have fired me as a patient because I just didn't know. But both of them were fine with whatever I was comfortable with, and the rheumatologist and the uveitis specialist both said, that's fine, we'll figure out what's next. And actually, my uveitis specialist said, you're really not a candidate right now anyway. I know he wants me to try something else at some point. I don't know. Right. Maybe he'll raise our grandchild for us so that
so you're not around the germs.
So I'm not around the germs. So what was going to be next is to get ready for a new device that actually gets implanted right into the eye, and it's an intravitreal steroid device that releases steroid right into the eye, which will be far better for panuveitis because the drops, like we said, the drops just don't get to the back of the eye.
Only the oral.
That's right.
So with that oral steroid.
But a device right in the eye is going to be
will work.
Yeah. So I already know that I'm steroid reactive. My intraocular pressure spikes from the steroids. Both oral and ophthalmic do that. And I had already grown some cataracts from the steroids. The cataract-induced steroids are called posterior subcapsular cataracts, and I had those in both eyes. And my uveitis specialist was actually just waiting for those to be bad enough that they could justify removing them, so that it could be a valve surgery to be proactive about what the intravitreal steroid was going to do, which it's going, when it happens, it will raise my pressure.
Right.
It's going to. We already know that.
Right.
So a lot of times people will get that steroid device in their eye, and then they grow a cataract, and then they have to have a valve.
Right.
And so he was going to be proactive. And so in July, my cataract had gone, I was 20/25 corrected with the cataract in my right eye, and in just about a month's period I went to where I couldn't see anything. I had to stop driving.
And you weren't even 100% sure that it wasn't just eye damage at that
right.
point. So you were hoping it was.
We were hoping, the doctors were pretty sure it was just the cataract causing the vision loss. But I couldn't see anymore of this. Everything was really, I could see that you were sitting there, but I couldn't see facial features, or it was just really blurry. Everything was just really hard to see. And I couldn't drive or anything like that. So by the time I had the surgery, the vision was plenty bad enough for them to justify removing the cataract. And so the cataract, in one surgery, they did two procedures, and they removed the cataract in this eye, and they inserted the implant, which was the Ahmed valve. That they went with an Ahmed valve because, like, the laser surgery or the littler valves that are really just a little short piece of metal tube, aren't necessarily great for people with uveitis because scar tissue from the inflammation is going to close them up. So because of why my pressure goes up, which is because of steroids, because of uveitis, they thought the Ahmed valve was going to be the best one for me. And so that's what we did. And then in December, we did this eye. Both procedures in one surgery. Right. And I experienced, the first one was pretty bad. The pain was...
You had some issues.
I had some issues. The very next day I went into the doctor's office, and he walks in the room. So you have to go back the next day after the surgery. And I'm sitting there in the chair, the big eye doctor chair. And he walks in and he goes, uh-oh. 10 feet away he says, uh-oh. And I said...
Not what you want to hear.
I said, what uh-oh? There's two people you don't want to hear uh-oh from. Your doctor and your hairdresser. They're fixing your hair, and they're behind you. You don't want to hear uh-oh then either. So you did that to me once. You remember that? She's behind me, and I have no mirror. She's doing something to my hair, and she said uh-oh. And I'm like... Anyway, so I'm sitting there and he says, uh-oh. And I said, what, uh-oh? And what he was seeing from across the room was that the anterior portion of my eye was flattening out because the valve was over filtering and my eye pressure went way too low.
Right, which can happen with that issue.
Yeah, and that's dangerous too. That's vision threatening too. It is. You can look it up. So, and it's painful. So he said, let's see how you do through the weekend. He was hoping it would resolve, and it didn't. I get back there on Monday, and it was another whole point lower. So he said, we're going to have to fill that eye back up. And I said, what? He said, we're going to fill that eye back up. And I said, you're going to stick a needle in my eye? He goes, I'm not sticking a needle in your eye. I'm sticking a cannula in your eye. And I told you, the difference is a needle is straight and a cannula is bent like this piece of your glasses. It's got a little crook in it. And a needle has a point. A cannula is blunt.
Which is a lot more painful.
So I got into the machine, chin in, forehead in, and I held on for everything I had, and his tech held my head, and in it went. And actually he went in from this part, from over here. And he injected with a cannula into my eye with no pain intervention. All that was in there was he had done that drop that they give you that numbs it enough for them to do a pressure check. He had just done a pressure check, so that drop was on board. Yeehaw. So he sticks the cannula in and he injected viscoelastic gel into my eye to bring the pressure back up. That started, and I counted, a 15-hour span of time where the pain in my eye was completely unbearable. I lay in my bed in the dark, it was unbearable. Yeah. It was unbearable. I couldn't stand. I couldn't have my eyes open. I couldn't move. I just lay there just waiting for the pain to ease up enough that I could function a little bit. It was awful. And I'm tough. I have a very high tolerance for pain.
And thinking about possibly having to do that again with the next eye.
I know. That's